Hello everyone, my name is Dr. Ominde and I'd like to wind up the lecture series on the gross anatomy of the neck. So we'll briefly discuss the roots of the neck, okay? So at the root of the neck, we have what you call the thoracic inlet, okay? We have what you call the thoracic inlet, and thoracic inlet is bordered anteriorly by the manubrium of the sternum, laterally by costal cartilage of the first rib and the first rib, okay? Manubrium of the sternum anteriorly, laterally by the first rib and its costal cartilage, and posteriorly by the body of T1 vertebra. So that's your thoracic inlet. Okay. Now, you have central markers in this thoracic inlet, and that's the scalene anterior muscle. Scalene anterior goes to insert onto the scalene tubercle on the superior surface first rib. And subclavian vein grooves anterior to the scalene tubercle, while subclavian artery grooves posterior to the scalene tubercle. What are the contents of the root of the neck? What do you find at the root of the neck? So you have the pleura, the cupula of the pleura, that's the cervical portion of the pleura at the apex of the lung. Then you have subclavian vein, you have thoracic duct, and the right lymphatic trunk. So cupula of the pleura, subclavian vein, thoracic duct, and right lymphatic duct. So, of course, subclavian vein, this is subclavian vein, that's subclavian artery, this scalene anterior separating the two. Then you have the thoracic duct and the right lymphatic duct. Again, that's vagus nerve. We also find it in the root of the neck as well as the phrenic nerve. Okay. So, this image here, there's something I wanted to discuss. As you can see, this is the first rib. Remember, first rib attaches on the manubrium and second rib attaches onto the sternal angle of Louis, because that's how you start counting your ribs. You first locate the sternal angle and you know that's the second rib. Of note, there's something here. If this is our first rib, so what is this? This is what you call a cervical rib. It's a variation, okay? So not everybody has it. So this is a cervical rib. It's in a few people, and it's a rib that comes from attaches onto C7 vertebra. Remember, first rib should be on T1, but this attaches on C7, and it doesn't come to the sternum. Usually, it's linked onto the first rib by fibrous tissue. As you can see on this other side, there's a cervical rib. Now, this cervical rib, it has its own clinical implications. As you can see here, what is it doing? It's compressing on the subclavian artery. Okay, so it contributes to what we call thoracic inlet syndrome. Okay, so it narrows the thoracic inlet, and you can see it's causing compression of the subclavian artery. So the root of the neck contains the cervical portion of the pleura, subclavian artery and vein, thoracic duct and right lymphatic duct, and you have vagus nerve and phrenic nerve. Next, we go to the triangle of vertebral artery. Where is the triangle of vertebral artery? As you can see here, we have a triangle. So medially, it's formed by longus colli muscle. Okay, this is muscle of the neck, longus colli muscle. Laterally is formed by scalenus anterior. Remember, we said it goes to insert onto the scalene tubercle on the superior surface of the first rib. Then inferiorly, the triangle is formed by the first part of subclavian artery. Remember, we said first part of subclavian artery is the part of subclavian artery from its origin to the medial border of scalene anterior. Second part is subclavian artery behind scalene anterior. And third part is subclavian artery after the lateral border of scalene anterior. So triangle of vertebral artery is formed by longus colli medially, scalenus anterior laterally, and inferiorly by first part of subclavian artery. The apex is formed by the transverse process of C6 vertebra. Okay. What is located posterior to this triangle of vertebral artery? There is the cupula of the pleura. Okay. The cupula of the pleura. We also have transverse processes of C7 vertebra. This is C6, C7. So posterior to this triangle, you have transverse process of C7, anterior rami of C8 nerve, and costal neck of the first rib. Then anterior to this triangle of vertebral artery, you have the carotid sheath, phrenic nerve, and the arc of thoracic duct. This is arc of thoracic duct. What do you mean by arc of thoracic duct? At the sternal angle of Louis, thoracic duct usually shifts from the right to the left side to come and empty at the brachiocephalic vein. So that's the arc. So it's located anterior to the triangle of vertebral artery. Then carotid sheath and its content, the phrenic nerve, all those are anterior to the vertebral artery. You can appreciate this is the phrenic nerve. It usually lies on the anterior surface of the scalene anterior muscle. So what are the contents of this triangle of vertebral artery? Of course, vertebral artery and vein. Remember, vertebral artery needs to course upwards before it starts entering the foramen transverse area of cervical vertebra before it enters the cranium through the foramen magnum. So we have vertebral artery and vein, inferior thyroid artery, of course, from the thyrocervical trunk of first part of subclavian. Then you have cervical part of the sympathetic trunk and the cervicothoracic ganglion. Remember, the sympathetic trunk and the sympathetic trunk comes from thoracolumbar portions of the spinal cord. So nerves come from thoracolumbar region of the spinal cord, but they go and form a sympathetic chain parallel to the vertebra. And this sympathetic chain, you have ganglia 3 in the cervical region, superior, middle, and inferior cervical ganglia. And then you have thoracic region, lumbar region. So you have your sympathetic chain that runs, this ganglia run parallel to the vertebra. Now, the inferior cervical ganglia, together with the first thoracic ganglia, sometimes they are joined to form the stellate ganglion, and this is the cervicothoracic ganglion. So the triangle of vertebral artery has vertebral artery and vein, inferior thyroid artery from thyrocervical trunk of the subclavian artery, cervical part of the sympathetic trunk, and the cervicothoracic ganglion. So some clinical correlates in the anatomy of the neck, like this, shows you goiter, which is an enlarged thyroid gland. It could be enlarged because of lack of iodine, so in the diet. So the thyroid gland is really overworking, okay, because the iodine is not enough. Or it could be a tumor of the thyroid gland. So that's an enlarged thyroid. Common cause is usually goiter. This shows you a brachial cyst. As you do embryology, brachial arcs or arches and brachial sinuses. So usually they're supposed to, after forming the structures, they're supposed to degenerate, but if they persist and retain fluid, they form brachial cysts. So you can see an enlargement in the neck region. This is a supraclavicular lymph node that is enlarged, so there is a problem. You need to investigate the regions that are drained by this lymph node to check for malignancy. So we've finished the lecture series on the neck. These are the questions I would like you to answer. You're likely to find these questions in your exam. Discuss the sites of internal and external carotid anastomosis in the head and neck region, and name the branches of internal and external carotid artery involved in each of the sites. So like in the nasal septum, the scalp, the medial angle of the eye, those are the sites for internal carotid artery and external carotid artery anastomosis, including the scalp. So you need to know which vessels. So you go back to those lecture videos because I have mentioned them. State the origin and termination of common carotid artery and state the landmarks. So you need to know that. Remember, common carotid at C4, C5 junction, it divides into external and internal carotid. State the extents, relations, and blood supply of the thyroid gland, which I have explained in detail, so go to that lecture video. Discuss the anatomic basis of 3 complications following thyroidectomies. Remember, superior thyroid causes with which nerve? Superior laryngeal. So if you ligate superior thyroid and you mistakenly ligate the nerve, what are the consequences? So you go to the lecture video on larynx and tell me what happens because the superior laryngeal nerve innervates the larynx. Then same as inferior thyroid nerve artery being close to recurrent laryngeal. So you need to know what are the consequences when you affect these nerves, okay? Then we have 3 clinical relevances of external jugular vein. You need to know that. You need to actually be able to write an essay on external jugular vein. It was not covered in the lecture video, but now I'm giving it to you as an assignment. What's the origin, the termination, the tributaries, and the clinical relevances? Because this vein is superficial and it's easily cannulated, okay? And apart from cannulation, you can tell whether you have increased pressures in the what is it called? Because it's a vein, remember, it's going to drain into the right atria eventually of the heart. So if there's a congestive heart failure, you tend to see the external jugular vein. It becomes very palpable and very visible. So you need to be able to explain the clinical relevance of this external jugular vein. Okay. Then you have the origin, termination, and tributaries of external and internal jugular vein. Of course, you by now you know internal jugular brachiocephalic trunk. And how does this internal jugular vein form? Remember, it's a continuation of your sinuses, dural sinuses. Okay, so from your sigmoid sinus, then through the jugular foramen, your continuous internal jugular. So you start having tributaries all the way from the pharyngeal, so from the dural sinuses as you come downwards. So you need to be able to write an essay on internal jugular vein. Write short notes on carotid body and carotid sinus. Which one is a chemoreceptor? Which one is a baroreceptor? Where are they located? The innervation and blood supply. Briefly discuss ansa cervicalis, which has been covered. Discuss the vagus nerve. Go to the lecture video on cranial nerves. Write short notes on phrenic nerve. Remember the C3 to C5 root value, which innervates the diaphragm, central part of the diaphragm, the mediastinal portion of the pleura, parietal pleura. Remember, phrenic nerve innervates biliary apparatus, parietal pericardium, parietal peritoneum, and when there is injury to phrenic nerve, what happens? Okay. Then discuss the distribution and branches of internal and external carotid. Internal carotid has been captured in arterial blood supply of the brain. External carotid artery has been captured in the neck videos. So get back there and learn about it. Discuss the parts and branches of subclavian artery. We've discussed that. Now this subclavian steal syndrome and scapular anastomosis. So this is your assignment. What is subclavian steal syndrome? Remember, I can't teach everything and cover everything in the videos. The student also has to have some work to go and find out something. So what is subclavian steal syndrome? Okay. Scapular anastomosis. Which arteries participate in the scapular anastomosis and which ones come from the subclavian artery? Then discuss the parts and the branches of the vertebral artery. Okay, vertebral artery has parts. As it leaves the subclavian, the part through the foramen transversaria, through foramen magnum, the one we see at the medulla before it joins to form basilar at the level of the pons. So what are the parts? What are the branches? Vertebral artery will supply the meninges, will supply the nuclear cranial nerves in the medulla. It will give posterior inferior cerebellar artery. So you need to know what are the branches of the vertebral artery. Okay. So you have bulbar branches, meningeal branches, posterior inferior cerebellar arteries, and so on and so forth. Okay. List the suprahyoid and infrahyoid muscles stating action and innervation. There's a whole table of all those muscles. Discuss how is the retromandibular vein formed. You can be asked to write an essay on retromandibular vein. So remember, superficial temporal and maxillary veins together, they will join. Then you have your retromandibular vein, and then common facial will join it at what point, and what forms common facial, and where does retromandibular vein eventually drain. So you need to be able to discuss that. Write short notes on spinal accessory nerve. What's the clinical relevance? Remember, it innervates trapezius and sternocleidomastoid muscle. So when there's injury, will you be able to tilt your head? Will you be able to shrug your shoulders? So that's how you should be able to um, discuss these things. So write short notes on sternocleidomastoid or trapezius muscle. Discuss the organization of the deep fascia of the neck and the clinical relevance, which we have discussed. Discuss the cervical sympathetic plexus. Discuss the relations, arterial, venous drainage of the thyroid. Discuss the cervical lymph nodes and their clinical relevance. Then we have discussed the parotid bed. We've not discussed the parotid in the head and neck. So which structures form the parotid bed and the parotid sympathetic and parasympathetic pathway, extraocular muscles, sites of injuries of certain cranial nerves, oculomotor palsy, what is Horner syndrome, anatomy of the eyelid. So all these, it's not only neck. I've tried to bring up all the questions that you can be asked in head and neck region. Okay, you have your blinking reflex, carotid triangle, all the triangles and the fascia. Write short notes on hyoid bone, number 34, hyoid bone. Okay, so you need to know that. Thank you very much.